Easy steps to a routine venipuncture procedure. Before beginning, wash your hands thoroughly with a commercial foaming hand wash under warm running water. Dry hands with a clean or disposable towel. Non-sterile gloves are required during phlebotomy and intravenous cannulation and must be changed between patient collections. Arrange all equipment on a stable table, attaching the tube of the butterfly needle to the vacutainer holder. Confirm that you have the required specimen tubes on hand. Be sure to have access to the patient's blood form in order to discuss their details. Also ensure that the tests ordered by the doctor correspond to the coloured blood tubes. Place the patient in supine position. Ensure to check with the patient that the personal details, including date of birth and name, provided on the blood form are correct. Once confirmed, be sure to explain the procedure to the patient. Before beginning, explain that the procedure may be mildly painful and enlist patient cooperation in remaining still during the procedure. Place the tourniquet 5 to 10 cm proximal to the venipuncture site, using the clasp to tighten. The tourniquet should be placed proximally enough so as not to interfere with the procedure. Request that your patient squeeze an exercise ball continuously in order to ensure the vein is visible. Describe to the patient the vein that is to be used during the phlebotomy. In this particular procedure, we are using the median cubital vein. Cleanse the overlying skin with a skin cleansing agent such as an alcohol swab to disinfect the venipuncture site. Do not repalpate the vein after skin prep.
You're not on camera.
Apply traction distal to the vein with the index finger of the non-dominant hand to prevent the vein from rolling during venipuncture. The index finger should be placed distally enough so as not to interfere with the proper angle of needle entry. Too much traction on the vein may cause it to flatten, making the procedure difficult. Hold the wings of the butterfly between the thumb and index finger of the dominant hand. The bevel of the needle should be facing upwards. For superficial and small vessels, as seen in this particular procedure, the angle of entry is often 15 degrees or less. Steeper angles of up to 45 degrees are required for deeper or larger vessels. While maintaining traction, gently yet relatively quickly insert the needle into the vessel. As the needle enters, a flash of blood in the tubing will appear, however it will only travel several centimetres up the tubing until a vacuum tube is applied. Once you have inserted the specimen tube into the vacunator holder, the vacuum in the tubes will cause the blood to fill. If an artery is entered during intravenous cannulation, indicated by bright red pulsatile continuous blood flow into the tubing, the catheter should not be advanced and the needle should be removed immediately. Once all samples are collected, release the tourniquet and then release the needle from the vessel. Immediately apply a cotton swab to the site and then apply direct pressure for a few minutes to reduce hematoma formation. Dispose of the needle in a biohazard container. Finally, apply patient identification labels to the specimen tubes and submit them to the lab.